Hey there, and welcome. Today, we're diving deep into the second trimester of pregnancy. You've probably heard it called the golden period, right? Well, we're about to unpack exactly what that means for you and your growing baby.
Yeah, it's a phrase that gets thrown around a lot by doctors, friends, pretty much everyone. And it suggests this amazing time of comfort and energy. But, it's more than just a sweet nickname. It's all tied to some really big positive changes happening inside your body.
So, let's get right into it. What is it that makes these middle months so, well, golden? What kind of transformations are going on, and what are the big milestones you can start looking forward to? Don't worry, we're going to cover all of it. Okay, so this is really the core of it. The whole golden reputation comes from how different it feels from the first trimester. For many, that morning sickness finally starts to fade away. You get this amazing surge of energy back, and this is a big one, the risk of miscarriage drops significantly. That alone brings such a huge sense of relief. Just so we're all on the same page, the second trimester officially kicks off at week 13 and takes you all the way through the end of week 28. We're talking about months 4, 5, and 6 of your pregnancy. This is a really crucial window for growth and development. So let's start with you and your body. This trimester is a time of just incredible change. I mean, some of it you'll see in the mirror every day, but some of the most powerful stuff is happening completely out of sight. One of the most obvious changes, of course, is your growing uterus. Think about it. At the start of this trimester, it's still tucked way down in your pelvis. By 20 weeks, it's usually right up to your belly button. And by the end, it's expanding up towards your ribcage. Your baby's first home is getting bigger and stronger every single week. And along with that growing baby bump, you might start noticing a few other things. Maybe a dark line down your abdomen, that's called the Linea nigra, or some stretch marks. Your breasts are also getting ready for their big job, so you might see darkening areolas or even a little bit of early milk, which is called colostrum. All of this, it's perfectly normal. It's just your body doing exactly what it needs to do. But really, while the outside changes are what everyone sees, the most mind-blowing transformations are happening internally. Your body is literally building a high-tech life support system from the ground up. I mean, the scale of this is just incredible. Your total blood volume can increase by a staggering 30 to 50%. That's to make sure the placenta gets everything it needs. To move all that extra blood, your heart actually beats faster, your demand for oxygen goes up, and all of this is orchestrated by a surge in key hormones. It's amazing. Now, all of those amazing internal changes in your body, they're all in service of the real star of the show, your baby. And this period is just a story of one incredible milestone after another. So we kick things off in the 4th month. Around week 13, your baby weighs about 100 grams. That's roughly the weight of a lemon. But trust me, they are growing at an unbelievable rate. In this month, your baby's face starts to look so much more human. The limbs are well formed, and this is when you might be able to find out the sex during an ultrasound. They're also covered in a fine, downy hair called lanugo, which helps keep them warm. And get this, inside their intestines, their very first bowel movement is already forming. Okay, fast forward to the 5th month, and your baby has already tripled in weight to about 300 grams. The speed of this growth is just extraordinary. And this month often brings the most magical milestone of all, quickening. That's the official name for when you feel those first tiny flutters and kicks. It's just, there's nothing like it. At the same time, their heartbeat is now strong enough for a doctor to hear with a special stethoscope, and their whole skeleton starts hardening from soft cartilage into solid bone. And by the end of the 6th month, as the second trimester wraps up, your baby will have more than doubled their weight again, now weighing somewhere between 600 and 700 grams. This month is so critical because it brings the milestone of viability. The baby's eyelids, which were fused shut, can now open. Their lungs start producing something called surfactant. It's a vital substance that will help them breathe air after birth. And it's these developments that mean a baby born now may be able to survive with specialized medical care. So with all this incredible growth happening, staying connected with your healthcare team is absolutely essential. Let's quickly talk about the key checkups and wellness practices for this trimester. Your doctor's going to schedule several important tests. You'll have blood work to check things like your iron levels, screening tests for certain conditions, and then there's the big one, the anomaly scan. This is a super detailed ultrasound around 20 weeks where they check your baby's development from head to toe. You'll also likely be screened for gestational diabetes. And on a day-to-day basis, it's all about nourishment and taking care of yourself. You want to focus on a diet rich in protein, iron, and calcium. Gentle exercise is fantastic, and getting enough sleep, especially on your left side to help with blood flow, is so important. Just keep taking your prescribed supplements and stay on top of any recommended vaccinations.
All right, finally, let's cover how to stay in tune with your body, knowing the difference between what's just a normal pregnancy ache and what's a sign you need to call your doctor.
Look, this trimester isn't always a walk in the park. You might get backaches as your center of gravity shifts, or heartburn thanks to those pregnancy hormones. Leg cramps, a bit of constipation, some mild swelling, these are all really common. And while they can be uncomfortable, they usually have a clear cause and are just a normal part of the process. But, and this is so important, it's absolutely critical that you know how to tell the difference between those minor discomforts and symptoms that could be signaling a real problem. Your body is really good at telling you when something's off, and you have to listen to it. So, please, know these danger signs. If you have any vaginal bleeding, severe pain, a sudden drop-off in your baby's movements, or you're leaking fluid, do not wait. Call your doctor or your midwife right away. It is always, always better to be cautious and just get checked out. The second trimester really is this time of incredible transformation. It's when this whole pregnancy journey starts to feel so real. So we'll leave you with this to think about. As you begin to feel those first flutters, that undeniable little sign of life inside you, how does that feeling change your connection to the whole journey ahead?